the cancer diagnosis was a beautiful day like today, and it was also my birthday. So I thought, hey, I'm gonna be all right.
My first reaction was just to go and research as much as I could about prostate cancer, because somebody else in my family had cancer. It was very close to me. So the first thing I learned with his cancer was to find out what is it and what's the enemy, rather than just reacting to that word cancer. It's like, what does this actually mean?
I am in a very good place because the cancer has subsided. I'm 5 years cancer-free.
I did a lot of research, and I talked to people about it, and then I spoke to various charities and said, can I speak to other men who've been on my journey?
I was diagnosed with prostate cancer in December 2015. Whereas the national figure is 1 in 8, it's 1 in 4 for black men. So we're at a higher risk of getting prostate cancer. The treatment received by black men, in particular in big cities like London and Birmingham, seems to be less positive than their white counterparts.
To have black men to share information about their diagnosis of cancer is a very complicated zone to get into, and this is because of the pride black men have in themselves.
Black men are particularly vulnerable because it's the cultural thing which has been handed down to them from generation to generation, where the granddad probably had it, but he wasn't even calling it cancer. He's calling it that thing.
I don't think black men will talk about this sort of thing because it's so intimate, and there's definitely a masculinity aspect.
And it's very personal and private, and it's something men don't like to talk about. So the normal way it's dealt with by most men is ignored, or they look for alternative ways of being treated.
This cultural stigma is very strong.
There's always been an element of mistrust the black communities have with the NHS, because for some reason we don't get the treatment we expect.
Most black people think they're treated differently, not treated the same as their white counterparts, so I think that's hard to overcome.
We know that we have a responsibility to work with our black patients, particularly because we can see from the results that it is our black community that have not been completing the surveys as much as we would like to hear from.
One of the reasons why we don't get the service is that we need to participate in doing surveys, we need to volunteer and join research groups, we need to be part of the conversation.
Through the National Cancer Patient Experience Survey, we've been able to have those conversations with them, and we can really understand now that in order to really work with that group, we need to think about how we communicate with them. So patients would receive their National Cancer Patient Experience Survey. That would be either through the post, or they can now complete online. The survey itself is anonymous. There is information in the trusts alerting the patients to the fact that the National Cancer Patient Experience Survey will be coming out to them, so that they are aware when they receive it.
The National Cancer Patient Experience Survey really helped us to get that initial information which told us that black men with prostate cancer did not feel supported. So I think that was really, really helpful for us to have that information from this survey. And that was a starting point for us starting working with patients to dig a little bit deeper into what exactly do we need to address this issue.
The reason why surveys are so important is because they lead to lots of feedback to the hospitals, who have focus groups, who can then discuss what is going wrong in terms of lack of support. And that's how I know Brother to Brother, Man to Man, the group I'm in, that's how that came into being.
This project, or Brother to Brother, Man to Man, is a really good example of where us as a Cancer Alliance, the South East London Cancer Alliance, has worked together with one of our 3 trusts in South East London to really develop something that's been really beneficial for patients.
What's been implemented is black men now have a platform to discuss their cancer concerns.
Black men do complete the survey, However, they are in their limited numbers.
Now is the time to take part. What has changed is that now they're being heard more, they're being listened to, and they're being recognized.
Black men need to know that 1 in 4 is too high, and if they don't start coming forward and giving the answers and giving the information, more black men will die unnecessarily.
Please complete the questionnaire. What you put in is what you get out. If you don't complete the survey, then we won't know what's happening in terms of your general well-being in that, and you're basically excluding yourself from the service. The service is there, you've paid for it, it's a world-class service, it's the envy of the world. Why don't you use it?
The joy I just get, trying to support, black men with prostate cancer, to be able to have that conversation where people are in this lonely place and they feel that I can talk and relate to this individual to make a difference is immeasurable, to be honest. And to see patients having the confidence to talk about it and now going out giving interviews shows how much impact the support group is having on their lives and their patient experience.